Yeah.
Yes.
Good morning, everybody. This is Pradeep, Ambassador of Change of GETI, Lucknow, and we are on this particular platform of disruptive education thanks to our mentor, Dr. Sunita Gandhi. Because of this platform, we are able to communicate with and give you benefits from teachers, principals, experts in several fields from India and all over the world. Today we have with us Mr. B.Elayaraja. He is a counseling psychologist with the Kavithalaya Counselling Center in Chennai, Tamil Nadu. He has an MSc from Chennai and MPhil from Annamalai University in psychology. And he has diplomas in hospital management and school counseling and others. He is an emphatic and compassionate psychologist with more than 15 years of experience in the mental health field. He facilitates individuals and goes in for group counseling. Professionally, he has worked with schools, hospitals, government health helplines, de-addiction centers, engineering colleges, and with corporate groups, what have you, Caterpillar, India Private Limited. He's worked in behavior therapy with students on exam fever, stress management, anxiety, behavior modification, and enhancing self-confidence. He has trained corporate groups like the Godrej, GETI, and Airtel, and works with Kendra Vidyalayas and other schools. So today, we welcome him here, and he will be speaking on let's be aware of depression and anxiety. Thank you, sir. Over to you.
Thank you so much. Very good morning to one and all. A special thanks to Dr. Sunita Gandhi, founder, and Mr. Pradeep Mal, the host and ambassador of change. Thank you so much. This is my second time working with GETI for presenting my psychological subject. And once again, thank you all. Let's go to the content of let's aware of depression and anxiety. So my preparation is all about a band-aid approach. So as we all know, like we need an psychological help for managing our psychopathology, which includes this anxiety and depressions. So I request you all to be attentive, not using your mobiles or other related contents. Don't try to maximum deviate and focus on. Let's talk about this discussion, right? So before starting the sessions, I just all want you to do a small deep breathing, and this deep breathing is something special. So this is called a diaphragmatic breathing or a belly breathing or focusing. Just inhale through the nose slowly. By the time your stomach should comes up or tummy should blows up, hold it for few seconds and exhale slowly through your mouth by the time your stomach should goes in. While inhaling, your stomach should comes up. Hold it for 4 or 5 seconds. Just exhale through your mouth very slowly by the time your stomach should goes. So let's all start. Inhale. Just hold. And exhale slowly. Super. One more. Inhale. Hold. And exhale slowly. See, when we do this deep breathing, actually we get an immediate effect from the anxiety or depressions, and our testosterone will not get secreted at any cost of time. So just try to implement this deep breathing at least 3 hours once for 2 to 5 repetitions. That sounds so good. So let's go to the topic. So, Pradeep Kumar sir, you can share the content PowerPoint. Yes. The PowerPoint is still on process.
The PowerPoint doesn't seem to be coming, doesn't seem to be showing.
Okay.
The PowerPoint is not showing, sir.
Yes. So, what is the next option? Let's stop the screen and come back again.
Okay.
Yes. Yes. Is it clear now? Pradeep sir, is that clear?
Yes, sir.
Yes. We shall proceed now. So I myself, thank you so much for your very great introduction. And this is B.Elayaraja, counseling psychologist and proprietor of Kavithalaya Counseling Center, which is located in Ambattur, Chennai of Tamil Nadu. And my website is kavithalayacounseling.com. You can go through that later. Yes. Let's go to the topic directly. As of now, the mental health plays a very, very major role after this COVID or during this COVID time phases. And this presentation is not specific to this COVID, but in general, it is better up to us to maintain our mental health properly. So it is natural for us to have a normal range of feeling like stress, worry, anxiety, or boredom, or even feeling sad at quite some of time. But when our stress, worry, anxiety, or boredom or low mood goes more than 2 weeks to 2 months, then we need to take a call. Apart from that, it is very, very normal to have a stress to some situation or to some people, or worry to some situation or some people, and the same for other symptoms too. So when it comes to the mental health is otherwise called as a positive mental health or a mental well-being or a subjective well-being, or in a colloquial, it is called as an happiness in general. It is just as a feeling of good and functioning well in all part of our life. When any sort of mental illness or psychopathological symptoms like depressions or anxiety or feeling low or worry or whatever it may be, when it affects your thought, feelings or behavior, and that impair your daily functional activities. Say, for example, as a teacher, we need a role of going to the class, taking a sessions, and preparing that. If a student, you need to attend the online class, you need to take care of his sleep, appetite, you need to interact with the family members, all will get impaired if you get any sort of mental illness. Only on that we need a treatment. That is why I'm specifically saying like again and again, only when we have a functional activities getting impaired or it is not working out, then we can proceed with the psychiatric attention. What is the benefit of staying well or having a positive mental health? The point here is we will be more helpful to other people. We will be more productivity and productivity about what we have been doing as of now. We will be more helpful to other people, and we have a very positive social relationship with other people, and our physical health, our life expectancy will get increased, because most of the people nowadays will have a cardiac related, I mean like palpitations or headache or neck pain or shoulder pain or chest pain, stomach upset or ulcer or knee pain or joint pain. sometimes body temperature changes, all that will comes to reduced if we stay well or if we have been very positively managing our mental health. And obviously it able to manage our stress, and it will not impact your day-to-day functional activities, and it will maintain your healthy relationship with your spouse, with your children, with your friends, and everywhere. Obviously, when we keep a very great mental health, there is a very, very low chance of getting into or a thought of having a suicide or a premature death. And let's see what is the factors that is contributing to this psychopathology. And the content which I have been going to showing you now is all based on my experience with a little bit of research content. So let's not be focused into only a research content. So it is all a practical experience which I got through my clinic and my exposure during this last 8 months to before many years. As of now, there are many peoples that includes the teachers or students or whatever it may be, they are finding it very difficult on numeracy and mathematical progression particularly is getting affected, because people are finding it very difficult to teach the content through the online to the students, because they don't like how to proceed with that. They are finding it very difficult to make students to understanding, especially on mathematical content. Some people or students is feeling worried, like nowadays online classes is like a distance mode. They are still worried about the quality of education that is affecting them mentally, and they feel like examination is on hold and they don't know when is this examination going to started, or how this exam is going to get proceeded in online or offline, even though the uh, exam is going to conducted on next month, but still classes is going to open on next month, but still all have been confused how to proceed it, because there is a lockdown for almost 7 to 8 months, which you all know, and all people has been traumatized of how to proceed on this academically. So some students have been not access to the technology. So this you can able to feel from the C grade of people, where they find it access to the network, or they don't have access to the best smartphone or a laptop. This making them so worried, and there are few cases reported suicide on this, especially when their parents cannot able to afford a smartphone or a laptop for their online classes. And other factors is all a fear of infections. Yes, as of now, there are so many people are getting pandemic or getting fear of infection, especially from the COVID-19. And few clients have been reporting like they have a coronavirus dreamings, and they think repeatedly about this COVID-19. And this is almost 8 to 9th month. People are finding there are few people, not all the people. People are finding it very difficult to come out from their home. They are not even making their wife to go for a work. They are not even making their son or a daughter to go for a school or to buy any sort of stationery items outside. They have been that much obsessed about getting these infections. And so many people are getting hypochondriasis. They're getting serious of about small changes in their bodies will directly correlate to the fear of infection. The people associate the sore throat with the COVID-19 infection. They feel the cold with the COVID-19 infection. They feel the fever with the COVID-19 infections. That's how nowadays more people are being associated with their bodily changes and with the COVID symptoms. So which is making most of the people to get anxious. So let's see that in detail about in the next slide. And reportedly, there are more increase of violence against the woman, especially with the spouse, and they are finding it very difficult to manage their marital disputes as of now. Social stigma, of course, as of now, the people who have been treated, and they find it very difficult to mingle with the people, and most of the people are not even talking to the infected people. They have their own stigma, like it may, they feel like something bad, like when we go outside or when we talk to other people. So that is one sort of social stigma, like they're finding it difficult to get the treatment. And decline in the quality of learning. Yes, there is a low speed of internet where most of the students finding it very difficult to upload. Even we had a difficulties when we have a startup of this program. And there is an increase of smoking, alcohol, tobacco, chewings, and narcotics as of now. This is also making few people to get anxious and depression. Boredom, very monotonous life from morning to evening, and this makes them to feel sad. and a few students are finding it very difficult to contact with their friends on a face-to-face basis. This makes them to feel low, and there are more students repeatedly using the mobiles. They say it's like they are using the mobile for online class, but indirectly there are few students who have been addicted to the porn, who have been addicted to the gaming, who have been addicted to the other gaming substance. Their screening time has been increased. On those days we used to say like the screening time has been reduced within 1 hour, but no other option due to this pandemic. The screening time has been increased. There are more adult, though more middle-aged people and more school students are taking the mobile to the restroom. So this is a severe part of addictions, and they used to have the mobile phone till the end of the night. Even they used to watch all sort of YouTube contents even at the 12 o'clock or 1 o'clock in the AM. So this is making them, most of the people, to have a sleep deprivation. And most of the people have been worried how to proceed with this technology, and most of the people has sleepless issues. There is a student's report said we don't have a school and we have only online classes, off the screen and just listen to the content. And so they are watching the movies, Netflix and Amazon Prime videos and all the things till 2 o'clock. So this is also creating a great lifestyle changes to them. And some people have the emptiness. And predominantly, most people have a fear of hospital. Even on 3/1/2020, they fear like going to the hospital. And fear of death, hypochondriasis, as I discussed before, and more financial worries. They don't know how to proceed, or they don't know how to even going to pay the fees for the next academic year or a month to their children's. And most of the parents are finding it very difficult to manage their children. They have a helicopter parenting, or they're finding it very difficult to manage a child learning, or they're making them to motivate the child to have in the online classes. It's so difficult for them to put into that. And pay cut for most of the employees, we know like this is a kind of another distress which is coming out recently. They have been working for 9 hours and they are just getting a 15,000 or 14,000 a month. IT sector guy who have been worried a lot, and he has a plan to put a resignation. But still, even if he puts resignation, you don't know what you're going to do on the next one, because there is no requirement as of now in any organization. So he finds cut. So educational shutdowns, yes, this is also affecting predominantly all sort of peoples, and unemployment and over workload, especially on IT sectors. So before, when they work in the office, they work for approximately 9 to 10 hours, approximately. But now when they are working from home, their time has been increased to 15 hours or even 16 hours. The workload has been increasingly to the IT sectors. And the managers, I came to know, I mean, when I see my IT sector's client, and the managers are forcing them to do, because since you are in the home, you need to make a chart and you need to show what you are doing on each and every hour. So this is making them stress, and most of the IT sectors has a back pain, and most of the IT sectors people has a eye related issues, irritations, dryness, watering on their eyes. All this stuff are especially to the IT sectors, and there are few people have been having a bodily changes, which I said before, like all sort of body discomfort. They have a sleep issues, they have a relationship distress issues, they cannot able to spend time with their children. It is all making them huge difference on their emotions. So all these contents, as of now, as we all know, like as per the DSM or ICD-10, there are so many disorders, but will specifically focus to these anxiety and depressions. So because of this, all these factors which I said before, we are nowadays getting more and more post-traumatic stress disorder specific to the death of their family members due to the COVID, or the fear of infection because of this COVID. And panic disorder, there are many people in the evening, they are feeling panic, nervousness, chest pain, palpitation. It becomes a automatic clock for them to have a bodily changes. And able to relax themselves, they are keep on washing their hands, they are keep on thinking about the obsession on the infection, they are keep on thinking about how they're going to do the work. There is a thought obsession, and there is also a behavioral obsession. So all these contents, as of now, And depression, people have been don't know how to do proceed or how to go further, and they have been stopped getting these sort of psychological disorder. And let's see in specific. So this is all for us, even for me, even for Pradeep, whoever it may be. So this is for all of us. Just imagine yourself for the past 2 weeks, which means a sad mood most of the day, almost every day. Either that could be even this includes for the children or even for adolescents, whoever it may be, kind of irritability and depressed mood, feeling like crying, feeling like irritated, feeling different, not able to do any sort of work, loss of interest in doing the usual activities, and they feel very tired, or they don't want to do any work. When you say yes to this symptom for more than 2 weeks, and when this symptoms persists for more than 2 weeks, obviously there is a chance like we are into a depression. So this is the simplest scale that we can able to find whether we are really depressed as on today. And going further to assess us technically, this is the questionnaire which is taken from Patient Health Questionnaire 9. This is a simplest screening, not a diagnostics tool. The simplest screening tool to check whether we are clinically depressed. Question 1. If we have a little interest in doing all the usual activities, say for example reading newspaper or doing household chore or doing a basic things at home. Yes, if you say yes, yes, we are into a depression phase. And feeling down, hopelessness about the future or present, this comes if you say yes, obviously we are into a depression. If the people sleeps a lot, and if they don't sleep, or if they have a broken sleep, or if they have a nightmare, or this is not includes if you take alcohol. So apart from alcohol, I'm saying that. So if you have a sleep disturbance, yes, we are into a depression phase. If you're being tired or have a little energy, yes, we are into a depression stage. If you eat a lot, or if you don't eat, or there is a gradual weight loss, yes, we are into a depression phase. And feeling bad about ourselves, that hopeless about ourselves, yes, we are into a depression phase. I mean, when we cannot able to concentrate even on a small things, even on the discussion, even on these presentations, when our mind keep on wanders about some event which has happened on the past or which has happened on the future, that's also comes under the depression phase. When some people speak so slowly, and when some people is so restless, yes, these are all the indication of depression. And this is most predominantly common like when you have a suicidal thought. It is very very common to have a suicidal thought or feeling like to die once in a while. There are IT sectors, people are used to say like, instead of working like this, I feel like to die. That is common. But when you feel like to die for more than 2 weeks, when you plan, when you talk with other people, like I'm going to kill myself, then that is a clinical note we need to take care of. After this 9 question, if you answer for more than 4, yes, we need to take care of ourselves, either by healing ourselves or we need to take a professional help. So these are all some of the way in which that we can able to manage our depression, and this is called a cognitive behavior therapy. I'm not going into an in-depth part, but most of the people says like whenever you are into a depression, just do your activity, whatever you like, do yoga, do exercise, drawing, or have a pet or whatever it may be. That's all works good. That is all works good, sounds so good, but in the same way we need to work on our hidden assumption, because all the depression comes how you think about yourself, how you think about others, how you think about a situation or a world. So this is how the depression starts. For example, I'm so ashamed of that report after getting some negative feedback. We have an assumption in our mind like we should never ever get a negative feedback. No, this is irrational. Try some realistic option. It is very normal to get a negative feedback. It is inevitable to have always a positive feedback. These are all makes so sounds goods on your thought process, which makes you to be realistic and to move very positive with other people. There is another option of just monitor your thought. Take a sheet of paper. Whatever the thought or negative thoughts which making you so disturbed, write the thought on that. Do some thought challenging. Ask why you are feeling these sort of things. Just try this practice. Even when you do this for at least 2 to 4 months, obviously you can able to feel a very great improvement. And this thought process changes is a process. It is not a one-time investment, it's a process. So we say it as a dose dependent effect. Say for example, if you have a headache and we take a paracetamol in the morning, we have a little effect in changing that headache. If you take morning and night, obviously you'll have a very great changes on the next day. So it is how you work out on these hidden assumptions, how you work out with the realistic option, how you challenge your thought process. This all plays a major role in changing your assumption, especially towards these depression elements. Apart from that, the general suggestion of working on any relaxation activities also sounds good. So which you're going to explain in the next. So this COVID-19 makes most of the people to get grief. Their loved ones have been affected. The loved ones have been expired, died out of this COVID. Of course, we all have been into a denial phase. We feel anger at some point of time. We feel why it is happening to me. We may be bargaining with the infection or bargaining with the God or bargaining with other people and paraprofessionals and doctors. We feel depressed at the end of the day. Why it is happening to me? Why the God is not working on it? Why the doctors are not working on it? Or whatever may be X or factors which is not working on you, which that makes you to feel more depressed. And obviously, over the period of time, when you take a therapy or when you heal yourself, obviously you come into a stage of acceptance. This makes you to explore more options about your present stress. You may have a new plans and you will move on to the present practical life. This is usually called a Gruber's Rose model, but still as a general suggestions, when we have a stress or a depressions, obviously when you have a right mindset to change ourselves, it takes few months or few days to get this acceptance stage. The only thing is we need to put effort. So that is why, like out of my clinical experience, I used to say, if the client says their chief concern or complaint, they are normal. If they attended, presented the client chief concern or complaint, they are into abnormal stage. There where the psychiatrist plays a major role. Yes. Next, we'll specifically focus on this anxiety and my body or anxiety disorder. So these are all the symptoms. Say for example, dizziness, headaches, kind of shaking on your hand, your face stains or red or feeling hot. Sometimes your temperature changes, you get palpitation, you get back pain, your numb will become tightened or frozen, your breathing will become so harder or faster, your leg will feel weak, your stomach will get a kind of changes, a kind of butterfly flying on your stomach, a kind of small sound, your sweat palms, you start to sweat on a armpit, you may start to shudder when you speak, your vision starts to get blurred, and there is a chance of muscle spasm or kind of shoulder pressure or tensions on your all over the body. These are all the small symptoms or major symptoms, it depending upon the severity that the anxiety clients used to get. So once it is into a moderate to the severe stages, we are supposed to get all these sort of bodily changes. And that's what I told you in the beginning, hypochondriasis, especially if some people have a pseudo symptoms, say for example, dizziness or a headache, or even a kind of palpitation, they will associate to the cardiac arrest. They will associate to the cardiac arrest and they don't find it to calm or relax themselves and do the daily activities. It makes them so worried and disturbed. How to treat this anxiety disorder? Very simple as that. We need to check which is the exact event triggering our emotions. What the event is actually making you anxious? Is this COVID-19 or is this particular symptoms of cardiac pain or any sort of bodily pain is creating you anxious? What is the assumption you are making about that inception? There are people will say like, sir, I'm going to die if I have some sort of jerk in my body, Sir, I'm going to have some major disease because no complaint is getting reduced. These are all your assumptions. Does this assumption match the fact of your situations, or it is just an assumption? It is not at all fact. It is all about your assumption and only one your assumption. This assumption comes because nowadays most of the people started to diagnose themselves with the Google. We say that as a Google doctor. Especially the anxiety disorder clients, when they diagnose a disorder on the Google, the severity of anxiety will go for 3 times more than the usual anxiety. It gets so worse, they cannot able to sleep, they will become so restless. So I suggest all the people, not most of the people, all the people to stop diagnosing yourself specific to the anxiety on the Google. If you really need help, talk to the professionals, especially the psychologist or a psychiatrist. That sounds so good. Or even your general physician sounds so good. Ask yourself whether what will happen. What will happen if you have a palpitation? The people will associate to the cardiac arrest. No, it is not actually. It is just a palpitation. It is just a jerk. It is just a small back pain. But we need to ask ourselves to assess the stuff. How many times you have made this prediction that has come true? Because whenever we have some assumption, no way that it doesn't comes to the true fact. Ask to yourself, what is the benefit of worry? Nothing. Like our anxiety will increase, we get depressed, our relationship will get reduced, our bodily symptoms will get increased. So there is no point, even 0.1% of benefits on worry. These are all the small questions, so you need to work out on yourself. When you work out on yourself, you can able to easily sort out. But still, if you cannot able to work out on this and you still find you cannot able to relieve from the anxiety disorder, better to have a consultation with the professionals. And moreover, how to treat this anxiety is you need to postpone your worry, or you need to set some time for worrying. Say, for example, you can set a time around 5 o'clock in the every evening, 5 o'clock to 5:15 or 5 o'clock to 5:30. Set the time, worry a lot, feel anxious a lot, no issues. But after that 15 minutes or 20 minutes, you should constructively, or you should force yourself not to worry on another time. So this is quite normal when you have a mild to moderate anxiety, but it is quite difficult when you have a severe anxiety. What is severe? Even though when you set time, you cannot work out on the specific time. Grounding exercise or 5-4-3-2-1 exercise or relaxation techniques. That sounds so good. That makes you to be on the present. It will not make you to go either to the past or to the present or even to the future. So this is a grounding technique. I suggest you to do it now. All you need to do is sit straight. We'll do it. We'll try it now. Just sit straight. Don't close your eyes. Just take one long deep breath. Inhale slowly and exhale. As I said before, open your eyes. See 5 things around your room and name it. Fan, AC, light, laptop, mobile, whatever. Just touch 4 things that you have been in that same position. Say, for example, your chair or whatever the things which is nearby you that you can touch. You need to touch 4 things. Yes. Now 3 things that you can hear. Hearing of fan sounds or AC sounds or someone's stuff. Even when I'm talking, you can hear my sound. 2 things that you can smell. Your room aroma, your perfume, or whatever it may be. I'm just giving you an example, but you need to think creative. And 1 things that you need to taste. If you have some coffee or water, you can taste it. Or else just imagine pickle taste or a biryani or ice cream or whatever it may be. This is called a grounding technique or 5-4-3-2-1 relaxation technique. And I will repeat you once again. 5 things you need to see, 4 things you need to touch, 3 things you need to hear, 2 things you need to smell, and 1 thing you need to taste. That's it. This, when you are doing this at least 3 times a day, clarity comes when you consistently think about some anxiety provoking situations. That may be about your health, or that may be about your virus, or that may be about X or Y factors. So when you do this grounding exercise, you'll be on the present. Maybe it will be difficult for a few days. Obviously, once you practice, absolutely, it is a clinical therapeutic exercise which really sounds so good. Next is called a JPMR, but this can be done only with a clinic setup and not over the online. This is Jacobson Progressive Muscle Relaxation Technique. It is tensing your muscles for a few seconds and relaxing your muscles for a few seconds. So this sounds so good, and it is a psychobiological relaxation techniques which really reduces your anxiety, it improves your sleep, it reduces your stress, and it has an overall physiological and emotional benefits. The next is called a deep breathing. As I said before, a belly breathing or a diaphragmatic breathing. This, when you are doing it, it sounds so good. You will also get relaxed at the immediate level. As I said before, just keep a journal of your feeling. That sounds so good. Sleep plays a major role in managing your anxiety. There are more people says like, sir, I am not sleeping for 2 to 3 days. Definitely not. They are lying. Maybe they have a broken sleep or a disturbed sleep. It is very, very difficult to not to sleep for 3 days. 24 hours into 3 days is highly difficult. So people may be sleeping, or a client may be sleeping, but they are unaware like they have been sleeping. So if you need to have a good sleep, there are so many techniques, but in a nutshell, take your supper before 8 p.m. Go to your bed around 9 to 10 o'clock. Whatever the work you do, please shut it down at 9 p.m. Try to not use your mobile on your bedroom or a laptop on your bedroom. Lie down, take a deep breathing for 4 times. Read a solid, boring books. Mark my point, boring books, which makes you to develop your secrete your sleep hormone called melatonin. You can also try with the sleep stories, which is available on your mobile. Even though I say not to use mobile, but you can use the mobile for a therapeutic purpose. Don't do the auto play. So just close it with the sleep stories. The sleep stories is a story which you need to focus 100%. Obviously, you feel sleep. And JPMR also sounds so good. Or counting 100 to 1 in a reverse mode will also sound so good for a sleep. And even though if you have a broken sleep, or even though you don't sleep, no issues. Wake up at 5:30 to 6, or if you wake up at 5 o'clock, it is so good. Start your day. Don't sleep in the afternoon or in your daytime. If you want to sleep, sleep for 20 minutes. That sounds so good. 20 minutes of power nap. That's it. And the next day night, probably 90% of the clients have a very great sleep. But in case if you still you don't say, and if you still say like you have a sleep disturbance, no issues, don't sleep in the night at all. The next day morning, from the evening or around till 8 p.m., don't sleep. Obviously, you get a very better sleep on the next night. So this is a military method, but you can use it only when you really need it. Or else the previous suggestions, it sounds so good to get a better sleep. Unless and until we are not addicted to the alcohol or smoking or any narcotic drugs or any sort of medication addiction. Or else anyone can get this nice sleep by following that suggestions. And challenge your automatic negative thought, which I have been discussed before, because don't associate anything negatively. Take it everything as an experience. Educate yourself, but not with the Google, with the doctor, with the webinar, with the seminar, with the standardized textbooks. That sounds so good. Be always connected to the social, I mean, with your friends, with the relatives, because you need to know where you are standing. I know a client who have been not even coming out of the house saying like, no, the COVID is not still dead, or there is no vaccination. So I feel so fear, I will not come out. We need to ask them to come out with their spouse or with their son or a daughter, ask them to go around, see how the people have been going with the safety measures of distance maintenance, mask, sanitize. Because no one knows when the vaccination is going to come. But anyhow, we need to lead a life safe. So focus on the thing that you can control. Don't assume on the thing that you cannot control. Thinking technique. This is so good when you have anxious. Whenever some thoughts comes on your mind, just ask to yourself whether it is helpful, whether it is true. Is it really a motivational or inspiring? It is whether necessary as of now. Is it a kind one? If you say no, please say to yourself, stop saying this, stop on your mind, put a red signal on your mind and focus on other activity or other visualizing thing. This is a thinking technique or a stop thought techniques which really works a lot when you practice for at least 4 times, 4 times a day, at least for 4 days. Just you need to check whenever this sort of thought comes, you need to ask yourself whether it is helpful or else say stop. Imagine when you are crossing the very busy road, we never think about anything. We will cross the road because if you are not focusing on that, we'll get into accident. That's the power of focus. So we need to change our thought to the other helpful thought. And focus what is there on your hand, which works mindfully. Being on mindful, I say it very in short. Whatever the work you do, whether you cook or you work for someone or whether you are an employer, whatever it may be, you work on mindfully. Be on present. Even when you eat, when you take coffee, when you drink water, be on present. That sounds so good. And do any activities which makes you so happy. Groom yourself, eat well, have a garden, pet, whatever it may be. Pet is the best therapy. We say it that as an animal assistant therapy, which sounds so good for most of the people. And because most of the beyond having an apartmental life, of course pet is not allowed, but still you can have an aquarium, you can have a good garden. That's all sounds so good, because whenever you see a greeny thing, our mental health will get improved as per the studies. So if you are infected by the COVID-19, no issues at all, you will get better. I'm pretty sure even the 2 months before I got infected, because I never closed my clinic, even from the March, I never closed my clinic. Of course, I got infected. I've been hospitalized for 14 days. The only thing is for the first 3 days, I got kind of depressed because my entire situation has been changed. So I just manage myself with reading books and having chat with the other infected persons. That's it. End up at the 12th or 14th day, I got discharged and started my work again. So it is doesn't mean like if you get infection, don't correlate corona with the death. Not at all. It's a corona is an infection. There is a death, of course. Imagine if the health department gives the same statistics of accidents, road accidents or whatever the accidents. It is equal in number. Imagine the accidents are equal number, which is not shown actually because we are not aware of it. So it is not like that. Be very positive. Even if you get a COVID infection, no issues. We can easily come out of it. But only when we have a very major, already a pre-medical issues like lung functions, or that is where the risk comes. That is why the most of the people are dying. So help to understand that this is a temporary content. I'm sure this will pass on. Apart from that, most of the anxiety people need a reassurance from the family members. Yes, Appa, or yes, Ma, or yes, Papaji, like nothing will happen. We are here to help you. As I said before, venting his emotions plays a major role. Whenever your parents or whoever talks about this anxious content, please listen to them. That itself give them a most trust. And appetite plays a major role. Do exercise. It is the cheapest medicine in the world. And be very careful about making assumption about event or a situation or about the people, because that triggers both anxiety as well as the depressions. Try to adapt to the change, because change is the only permanent thing that we need to adjust and adapt. So this is the worst thing as a word, but this is a disconstructive way when saying it professionally in handling our anxiety or depression. Never take alcohol for a sleep, or never take alcohol as a stress buster. There is one tool called RAPS4. Remorse, amnesia, performance, and starter. When you feel guilt for the last drink, we are addicted. When we have a more memory loss recently, yes, we are addicted. Especially the working memory will get affected. When our performance or work will get affected out of this alcohol, yes, we got addicted. When we started to drink alcohol in the early morning, yes, we are addicted. So never ever use alcohol, even though the doctor says like 30 ml of alcohol is good for our health. I'm pretty sure no one will stop by 30 ml or small. Smoking, of course, even a 2 cigarette is poisonous. So that is also a different question. So when we smoke more than 3 cigarettes, when we take our first cigarettes in the morning, when we are sick, hospitalized, and when we smoke, yes, we are addicted. Even when we go to the church or masudis or temple, wherever we go, when going before and after coming out from the temple, when we started to take smoking, yes, we are addicted to the nicotine. For all these two habits, alcohol and smoking, we need to stop at once and feel the withdrawal symptoms. For both alcohol and smoking, you can drink more water, you can fill your stomach with food, you should avoid the using friends. All this sounds so good. Never use a prescribed or unprescribed drug in the pharmacy. That was a lot about your conditions. And don't try to harm yourself. It is a sin. And even though when we are into a next generation after our suicide, we need to face these sort of distress. So it is better as of now to face the distress and fight with it. Either you need to fight with the situation or you need to fight with the situation. That's it. Very few situations need a freezing. You should not never react. Never react with your spouse or never react with your people who have been angry. Just calm yourself. The next day you will be asking sorry to you. But still, if you have a suicidal thought, just close your nose and mouth together for a maximum seconds. You will have a suffocations. That's how you can cope up your self-harm. You can also try a rubber band technique. Just release it and you will feel some pain. Obviously, your thought will get reduced. Never be alone. And if your friends or neighbors or if your family members has a suicidal thought of talking to you, please give them a professional help. Never overeat or never undereat. These are all the disconstructive way of handling our anxiety or depression. So finally, if you have a stress, don't come to the psychologist or a psychiatrist. Talk to your family members. Talk to your friends. Your problem will get solved. If it is not working out, then you can seek for a professional help. But when choosing your friends, they should be very positive enough to give you a suggestions or a kind of ventilation part, or else you both will become depression after sharing it, because that guy will be already into a depression phase. When you share your depression part, both will get the same depression. So choose your friends or choose your relatives who are very good in positive mental health. So finally, as I said before, the take-home message, this will sure pass off, and you are so important to yourself. Your company can replace Ilayaraja with Bharati Raja, but your family cannot replace Ilayaraja with anyone. So you are most important to yourself. Stay calm, stay relaxed. So take care of your elderly people. As of now, they are getting more affected psychologically, especially on fear of getting infections and fear of being alone. So take care of them, talk to them, be with them, play with them. That's itself sounds so good. And as we always used to say, our phone is already has become replacement for our watch, cameras, calendar, and alarm clock. Please don't replace that with your family. Talk to your family, interact with your family. Just it is good not to use your mobile after 9 p.m. It is good. So as I said before, when you are managing your emotions or your stress or anxiety properly, you will never get any sort of bodily changes, or else there is a chance like we get a cardiac arrest or a sudden death or immune system weakness, we get a fever, cold all the time, asthma, diabetes, peptic ulcer, psoriasis, menstrual problem for women, depression, especially the migraine. Most of the women has a migraine and most of the men has a chest related pains, psoriasis especially. So take care of yourself, follow the recommendations, and if you find it very difficult, please talk to the professionals. Going to the psychologist or a counselor is no more taboo. It is like just going for a general physician. Even though we say this dialogue or we say this statement at many point of time, but still only the people when they have a chronic mental health, they will take their son or a spouse to the counselor. be aware when you have a startup stage itself, it is better to have a counseling. The counseling is nothing but the talking therapy. We work out on your thought process, how to reconstruct or rewire your thought patterns towards your previous situations or to your past situations or your assumed situations. So it is good when you talk with professionals. So thank you so much for your time. So it is almost 50 minutes as of now. You can write up your feedback at Kavithalaya Counseling Center. You will have a review page. You can put up, if you're okay with the presentation, you can put up your reviews on you got benefited like that. And yes, this is my clinic about. So thank you so much. Over to Mr. Pradeep, sir.
Thank you, sir. That was a very clear talk and leaves very little room for questioning. But
Yes.
I would just like to ask you one question very relevant to our schools, and that is, what are the psychological impacts on the Zoom training that we are doing for students, both on the students as well as the teachers who are taking it?
Yes, yes. So there are two ways. We always say like stress reaction will it depends upon the individual to individual. There are, when coming into the students, yes, there are few students who got irritated by seeing that laptop or a mobile all the time. There are few students who have a physiological changes, as I said before, of eye irritations, watering, and everything. And there are few people, I mean, few students are really taking advantage. They say, it's like, sir, it is so flexible and we can able to hear the recording or audio whenever we want, and we are being into the home, and as well as we can able to learn. That is one aspect of people. When coming into the teachers, yes, of course, they too have their own difficulties in tackling that, because the network plays a very, very major role. It gets blocks. They don't feel get connected with the students. They feel worried that how their teaching content is going to reach the students. All this stuff has its own plus points and minus points. So it is up to us to see that positively, because as we all know, it is a pandemic. Yes, it will come to an end within a few days or a few weeks or a few months. So let's have a positive hope and sort it out, all these issues. So let's make this situation as challenging and learn from this tough situation. Because we have been habituated to watch all the movies in the phone and laptop. Why we are not habituated to learn from the laptop? So it is up to our mindset to adjust and adapt to this change. Yes, sir.
Thank you, sir.
Any other questions?
So once again, thank you to Dr. Sunita Gandhi for this excellent format of disruptive education. And that was Mr. B.Elayaraja, the counseling psychologist, on Let's Be Aware of Depression and Anxiety. I hope you enjoyed this, and thank you so much for being there.
Thank you.
Good afternoon, everybody. Thank you.